Hi everyone, welcome to Women's Health Weekenders. I'm Perdita, the beauty editor, and today I'm joined by two of the UK's leading skincare pros who are going to talk us through how to look after your skin at any age. So without further ado, let me firstly introduce Dr. Anjali Mahto, consultant dermatologist and author of the Skincare Bible. Hi Anjali.
Hello.
And also joining us is aesthetic doctor and founder of the Adonia Medical Clinic, Dr. Ifeoma Ejikeme. Hello, how are you?
I'm good. I'm really
Okay, so we know that if you are new to the world of skincare, it can be really tricky to navigate. But also, even if you have a well-honed regime, there's a never-ending list of buzzy ingredients that always seem to launch. So hopefully, we can kind of really decipher the world of skincare today. And if we start by talking about how to create a skincare regime in your 20s. So Anjali, let's kick off with you. 20s, what do we need to know? Ingredients, regimes, tell us everything.
Sure. So, I mean, one thing I would say is the 20s is your absolutely right time to get into good habits for your 30s, your 40s, and so on and so forth. So the first thing, often overlooked, but cleansing your skin is the backbone to any good routine, and ideally cleansing morning and evening, because it allows you to, first of all, remove all of that dirt, sweat, grime, pollution, sunscreen, makeup that we've got on during the course of the day. But it also then forms a base for the rest of your routine and your actives to go on. So cleansing morning and evening, absolute must. And ideally in the evening, if you are wearing makeup or sunscreen or lots of layers, making sure that you're double cleansing. So your first step should really be making sure that all that makeup has come off, followed by a foaming or a cream cleanser of your choice to make sure that any residue has gone. Second thing, sunscreen. Important part of every single decade of your life. What we know is from your mid-20s onwards, you do start to lose about 1% of your body's collagen per year. So collagen is that protein that gives your skin its support, its structure. And as we start to lose it, that's what gives us our lines, our wrinkles. And I hate the word sagging, but slight sagging of the skin.
Yeah.
And 80 to 90% of the signs that we associate with skin aging occur directly because of sun exposure. So wearing sunscreen can certainly limit or slow that process down. So that's vital number two. And then number three, late 20s onwards is probably a good time to start thinking about active ingredients like your vitamin A or your retinoids.
Amazing, thank you. And Ifeoma, what would you advise for 20-year-olds who are possibly struggling with acne or any skin conditions? How can they kind of tailor their regime so it suits their skin type?
So that actually, Anjali Mahto just actually dropped that off right at the end there, bringing in your actives. So I would say that's really what you need to start thinking about. She mentioned some really good points there about the intrinsic and the extrinsic elements in your 20s that can start to really kick in. So I think of your 20s as your prevention. That's the time when you need to focus on all things prevention. And that includes things like acne. So with acne, the key element there is things like salicylic acid. So when you think about acne, there are three main elements that we need to work on: inflammation, bacteria, and oils. And it's important that with your skincare, we try and tackle those three things to kind of keep on top of your acne. So the first is inflammation. So anti-inflammatory ingredients like azelaic acid and salicylic acid at 2% are great to bring into your 20s. Your anti-inflammatories get those, your antibacterials are those as well. And then your oil balancing, things like benzoyl peroxide can be really, really great. When you're looking at your 20s, think about the cleanser that you want to use, and your foaming cleanser is great. I love the CeraVe foaming cleanser. It's cheap, it works.
Yeah, and it's really affordable as well, which I think is really important in your 20s. If you know kind of budgets, it can be tricky.
Exactly, and the foaming cleanser is great. So in your 20s, again, just as Anjali mentioned, you need to think about your cleanser, and your cleansers can be great to help with things like acne. Now, if you are getting acne in your 20s, you shouldn't just try and manage it yourself. especially if you're noticing redness if you're lighter skin tones and pigmentation if you're darker skin tones. So these are signs of scarring. This is the time to seek help. So it's not just something you should do at home. If you have these signs, it's important to talk to myself or someone like Dr. Mahto, who can help to bring in actives and bring in even medication to your routine to help.
And what's the best way to go about finding help, finding the right dermatologist?
So the first thing that you should do is speak to your GP. That's the very first step. Speak to your GP and ask them what's going on with my skin. Talk to them about your skin. Now, after that, you can seek different types of help. You can look at someone like myself who can help you with different elements, or you can get a referral to a dermatologist who can help with prescription medications like Accutane.
Perfect, thank you. And this is a question for both of you, but obviously we know that SPF is really important to use it, as soon as possible. So which products and formulations do you love?
So personally for me, I'm a big fan of the HelioCare 360 gel oil free, because having been acne prone my entire life, that is probably one of the few ones I find that does not clog my pores, but also sits nicely underneath makeup. If you've got issues though with post-inflammatory hyperpigmentation, so you're getting dark staining in the skin as a result of your marking or your scarring, and you've got skin of color, it's important that you choose a sunscreen that has got iron oxide in it, because that can help reduce the risk of further pigmentation moving forwards.
Lovely, thank you.
There are a few I like. I like the Super Goop. That's really nice, unseen. The City Skin by Murad. These are two that if you have skin of color or you have Black or Asian skin, you're not going to see that kind of reflective element. If you have current acne, it's really important to look for a sunscreen that's non-comedogenic, which means it's not going to worsen or inflame your acne. And there's one that I like. It's the Obagi Sunshield Matte. It is mattifying. It can leave a very, very slight tint, but I really like it because it's not going to trigger your acne.
Perfect, thank you. Okay, I think that's everything for 20s. Let's move on to 30s. So we know that obviously this is a decade where there are so many sort of big life changes in terms of, having babies, or just like stress related. We're all kind of suffering the effects of COVID, and it's been a crazy few months. So, things like sleep deprivation, how does that affect skin in your 30s? Ifeoma, should we start with you?
Yeah. So exactly as you've mentioned, for me, the 30s is your time to control. And that's what's happening, really. We need control, don't we, in these times? We need some control. But your 30s is the time to try and control the skin. And the reason I say that, because there are lots of things that may have happened in your 20s or even earlier that you can start to see very slight changes in the skin. Mm-hmm. Things like pigmentation can start. And people sometimes get pregnant in their 30s, and you can see changes to the skin, such as chloasma, which is pigmentation in pregnancy. You can also start to see early signs of sun damage. Opening of the pores or widening of the pores can start to happen, and very, very mild fine lines and wrinkles can start to occur in your 30s. So again, we've mentioned that after the age of about 25, you're losing about 1% of the collagen in your skin. So this builds up in your 30s as well, and you will start to see very slight jowling. This is the time that happens. And you notice this by, if you pick the skin up in your jawline and let it go, it doesn't snap back quite in the way that it did. And you start to see that in certain areas of the jawline and underneath the eyes as well. It just takes a little bit longer, more than 2 seconds to snap back. So you start to see that as well. So that's where your ingredients can kick in to really start to stimulate collagen. So there are some ingredients that can help with this.
And what would be your go-to ingredients for treating this?
My first would be retinoids. So there's such great evidence with retinoids to help with stimulating collagen. It's probably one of the most researched skincare ingredients. And I really love retinaldehyde at 0.05%. This is great because everybody can use it. You can use it for more sensitive skin types, and there's great evidence around it as well. Another one is the Medicate Retinoid. That's really nice as well. So that's a good one that people can pick up.
And retinol's got a bit of a kind of a tricky reputation. So do you advise starting, with a low percentage and then working your way up?
100%. So retinoids are a large group of products, and there are many different types of retinoids. They're in the family of vitamin A. You know, we have spinach on one end, which we know doesn't do anything to the skin. You top it on the skin. And then we have Roaccutane or tretinoin, which is retinoic acid, which is the strongest. And that's a prescription medication. Now, over the counter, you can find many different types: retinols, retinals, retinol esters, and retinaldehyde, which I mentioned. So whichever one you pick, what I recommend is you start with the lowest dose in that brand, use it about 3 times a week, and use what I describe as the sandwich technique. So you'll use your moisturizer first, then use a thin layer of the retinoid, and then your moisturizer on top. And you'll do that 3 times a week. And that will prevent some of the things we've heard of retinoids, like the redness, the peeling, irritation, and in darker skin tones, pigmentation. So if you use that technique, you'll overcome that. And it's actually a really nice product to use. It's very, very gentle when you use it in that way. And then as weeks go by, you increase it. So 3 times a week the first week, then 4 times a week. Then you take out the sandwich. So you take off the first moisturizer and then the second moisturizer, and then you're just using retinol straight on your skin.
Lovely, thank you. And Anjali, what advice would you offer for anyone who wants to dip their toe into the pool of acids? So you've got your, your glycolics and your mandelics.
Yeah, so if we think about acids, you've got your exfoliating acids. So you've got your alpha hydroxy acids and your beta hydroxy acids. So your AHAs are things like glycolic, lactic, mandelic, and they work by removing that upper layer of dead skin cells. So the idea is that if you remove that upper layer, the stratum corneum, what you're doing is you're leaving behind a slightly more glowing, brighter complexion. And most people can benefit from introducing an alpha hydroxy acid of some sort into their routine. If you've got normal skin, your skin's quite resilient, it's oily, it's blemish prone, then using the alpha hydroxy acids like glycolic and lactic work quite well, or a beta hydroxy acid like salicylic. On the other hand, if your concern is pigmentation, mandelic acid over the counter can be quite a helpful ingredient. If your skin is super sensitive and you find that you get a lot of redness and peeling as a result of using these, there's a new generation of alpha hydroxy acids known as your polyhydroxy acids. So these are things like lactobionic acid and maltobionic acid. And what they have got is extra hydration properties. So what they can do is be quite good for those that have got very, very sensitive skin that would otherwise react. But I think we can all benefit from some form of exfoliation. The key thing though is caution. I think there's a tendency to want to use too many products too quickly. And what ends up happening is you're using all of these actives in one go. And the next thing you know, you've got redness and peeling and flaking, and you're developing irritation and sensitivity. So it's also just being a little bit sensible about how you introduce these products and how many new products you introduce at one time.
Okay, and so if you were using the retinol, you wouldn't necessarily advise using all the acids at the same time?
So I know that that's normally what we say. And what I would say here is there's no hard and fast rule. The reason why, from a safety point of view, we say don't use your acid and your retinoid together is because if you exfoliate the skin, then you put on your retinoid on top, it will penetrate deeper. So it's more likely to cause irritation. That said, there are a couple of combination products on the market that do have both of them in them. So it's not that you can't, it's that you need to be very careful, and only if your skin is fairly resilient or oily will you find that you'll probably tolerate it.
Okay, lovely, thank you. And Ifeoma, what's your take on eye creams? Just because I think a lot of 30-year-olds, as you both have said, collagen levels are starting to deplete, and you can get kind of, the crow's feet or minor lines. What are, both of you, what are your thoughts on eye creams?
So eye creams are not going to revolutionize your eyes. I think that's important for everyone to know. If you have deep lines, if you have even fine lines, it's not going to necessarily reverse those. But I do like an eye cream. The area around the eyes has the thinnest skin of the face. It's sensitive. So we need to be thoughtful about what products we're placing in that area. So I like an eye cream to prevent. And so for me, the ingredients that are in eye cream are really important. So things like hyaluronic acid and glycerin to pull moisture into the skin. These are humectants, so they pull moisture into the skin. Ingredients like ceramides that then lock them in. So that's helpful because if that skin is thin and dry, then those things will help. Now, the second reason I like an eye cream is to prevent. So an eye cream that has an antioxidant that can kind of combat some of the damage that free radical, these energized cells, can have in the skin. You know, left unchecked, these free radicals can cause things like pigmentation, redness, and fine lines of wrinkles. So a proactive step to prevent it, for me, is a good idea. And there are some studies that have done split face studies where you've had eye cream on one eye and no eye cream on the other eye. And then they've, you know, waited some time. And there is a difference. But for me, that difference is from prevention as opposed to reversal. So that's how I think about my eye creams.
Thank you.
And I think the one thing I'd add as well, actually, to that, which I completely agree with, is also from the prevention point of view, making sure you put sunscreen on your upper and your lower eyelids. It is one area that we're really good at applying our sunscreen as part of our routine, but we just do not think about taking it up to the lash line. And if you are using a chemical sunscreen, a lot of those can irritate the delicate eye area. So this is one instance where I would say using a mineral-based sunscreen, so something that contains titanium or zinc, may be better around the eyes because they're relatively inert, they're less likely to cause irritation.
Lovely, thank you. And finally, what are your thoughts on, for anyone that's looking to perhaps possibly get Botox in their 30s, or, you know, wants to investigate the realm of injectables?
I think it's a great time to think about it. So injectables, we have this term injectables, but there are many different treatments that come under that. You know, you've mentioned Botox, there's dermal fillers, and there are things like PRP. So if you think about Botox, Botox addresses lines and anything that's linked to muscle activity. So the tiny crow's feet around the eyes, the glabella lines, so these 11s, and the forehead, these can start to deepen in your 30s. And the thought process behind that is, if you're using these muscles when you're not intending to, so for example, when you're sleeping, you're grimacing, when you're trying to look far away, you're squinting, you're not actually trying to convey that emotion. For example, when I smile, I want to use my eyes. I want to be able to use my eyes, but probably not when I'm looking far away. So the way I like to think about injectables like Botox is that it reduces the background tension in those areas so that you're able to animate, but you don't have to use them when you're not trying to. So that's a good way to use things like Botox. Now, or botulinum toxin type A. Now, dermal fillers are quite different. These are often hyaluronic acid fillers that are used to lift. Now, in your 30s, you can start to lose mid-face fat. So that's fat in this area. You kind of lose the baby fat. So the face becomes much more sculpted. Now, some people love that. And if they're facial type, it looks great. And other people can lose fat in an area that they look a bit gaunt.
Right.
And so placing small amounts of dermal fillers in different parts of the face can gently bring back a little bit of that structure that you may have lost. So I think it's a great treatment for the right person.
Thank you. And again, just because it's a treatment that's not hugely regulated, so how do you ensure that you are seeing someone, you know, where their, you know, safety is, you know, front of mind?
So I'd say there's a couple of things. I mean, the first thing I advise actually is these are medical treatments and they have complications. So you want to make sure that you are not having a non-medical person inject you. So by that, I mean that if somebody is a trained doctor, dentist, nurse with a prescribing license, that's all good. But if you're talking about somebody that is a beautician that may not have that training, I would say that you're potentially asking for trouble. So the first thing is it has to be a medical person that's injecting. The second thing I would say is, you know, usual things. Check out their word of mouth. Check out what their website's like. Check out their befores and afters. Has anyone that you know been to them? So all of those things are super important. Is the clinic that they work in reputable? Does it get good reviews? So all of those are things that you need to think of. And then this one's a little bit of an unsaid thing, but I would say that with a lot of people that work in the aesthetics industry, there can sometimes be a fine line before you sometimes notice that people start to look overdone or overfilled. And I think we all recognize this when we go to meetings and we go to conferences. And I would also argue that it's really important that you want to be sure that the person that's injecting you hasn't lost their own aesthetic eye. And what I mean by that is if the person that's injecting you looks very overfilled, or their lips look very overfilled, or, you know, literally like forehead doesn't move at all, and that's not the look you're going for, that probably is not the right person to be injecting for you. So that's more of like the kind of softer things that you're looking out for, but I think actually really, really important kind of side thing that you should be thinking about.
Thank you. Yeah, that's such helpful advice.
There are a few regulatory elements as well. So whilst we know that the aesthetic industry is not that well regulated, there are some registers that you can check. You know, so Anjali's mentioned GMC for doctors, GDC for dentists, LMC for nurses. Have a look, make sure that they really are who they say they are. And then we have other registers like Save Face, which I think is a great register for people to know about, because it means that they've met a certain level and they've been checked for aesthetic procedures and they're working in a safe and effective manner. So that's what people should remember. You can Google that and check it out.
Thank you. Okay, and then moving on to our 40s. So again, how does you know, hormonal changes affect the skin, or for anyone that's going through perimenopause, you know, what can you do to kind of combat that and keep your skin looking healthy and beautiful? Anjali?
As you come through your 40s, I mean, early 40s, I would lump with late 30s. It's very similar. By then, you should already be on your sunscreen, your retinols, using your acids to exfoliate if you want to. But as you creep through the fourth decade, what you will find is that your estrogen levels will start to drop in females. And that becomes problematic from a hydration point of view. So estrogens in our skin are really, really important for the production of what we call glucosaminoglycans. So that's ground substance that your skin is made of, your hyaluronic acid.
Right.
Estrogen is also important for oil production or sebum production. It's also important for hydration. It prevents transepidermal water loss, so water loss from the surface of the skin, all of which help to improve barrier function. So falling estrogen is clearly going to impact on every single one of those levels. So what people will find is that their skin will start to get more dry as they start to get older, as they start to creep up towards the menopause. So that's one thing to be careful of.
And what are kind of the key hydrating ingredients that you should really look for? Because obviously there are a fair few, aren't there?
There are, and when you think of a good moisturizer, a good moisturizing agent, you know, it's basically broken up into three different categories. You've got occlusive agents, which basically form a film on the top layer of the skin to prevent water loss. So these are things like lanolin or petrolatum or your mineral oils. Then you've got your emollients, which kind of fill in the cracks between the skin cells. So, you know, so again, in terms of ingredients and things, you have to talk about things like glycerin. And glycerin is probably one of the key moisturizing agents that you can think of. Second one is ceramides. They're both really, really useful things. And then third thing is like your humectants, things that bind water. So your hyaluronic acids. So most moisturizers will contain a combination of these occlusives and humectants and emollients. So if your skin is super dry, you want to go for something that's slightly occlusive heavy and maybe lighter on the hyaluronic. On the other hand, if your skin is less kind of dry and it's more oily, you want something that's got more hyaluronic in it and slightly less occlusive, so it won't block your pores.
And one ingredient that is obviously, you know, hugely loved by dermatologists and aesthetic doctors is vitamin C. So is that something you should sort of, you know, use it in every decade, or particularly in your 40s if you're suffering from kind of dullness or you want antioxidant protection?
I'd probably say you want to start with Vit C in your 30s, actually, assuming, of course, you've got all of the other things already sorted that we've talked about. Then using vitamin C, particularly in the morning, underneath your sunscreen or underneath moisturizer sunscreen, depending on how you're layering, can be beneficial because it's an antioxidant. So it will reduce that free radical damage from pollution as well as the sun. It's also a skin brightening agent, and it will also reduce inflammation as well.
Brilliant, thank you. And last but not least, kind of your 50s and beyond. So, you know, if for women that have hit the menopause, presumably, you know, does dryness ramp up, or again, how do hormonal changes affect the skin?
So the skin changes in so many ways at this point. You know, Anjali's mentioned that estrogen elements drop down, but also all the other hormones also drop down. Your testosterone levels in females drop down, your GH, which is very important for your skin, your growth hormone, and also things like thyroid stimulating hormone, all of these drop down. And when that does, it has changes to all the different layers of the skin. The epidermis contracts, the dermis contracts, and you can see changes elsewhere, such as the hair. So the amount of blood flow to the scalp decreases, and you also can get miniaturization of the follicles, and so you can get hair loss as well. So there's changes in lots of different areas to the skin. Not just skin deep though, also deeper. So you then get changes to the bone. So you can see things like widening of the eyes and changes in the chin, so recession of the chin. So because of that, we have to think about the different ingredients that we need to kind of supercharge the elements of the skin. And one that I do like are peptides. So peptides are the amino acids, which are the building blocks of the skin. So collagen, elastin, these are made up of peptides, of amino acids. And so adding this to the skincare routine is a great thing, I think, in your 50s. Now that plus your retinoids and the antioxidants that you've mentioned are really great to kind of zhuzh and rejuvenate the skin. So I think that's something great that you can add to your skin. Now, one thing that I really like for my patients in their 50s are resurfacing treatments. Now, we've talked about chemical peels and how these can be used to kind of increase the skin turnover for the top layers of the skin. But we know that in your 40s, 50s and beyond, the skin turnover starts to lengthen. So if you think about a young baby, they've got dewy skin, and every time their skin replicates, it replicates without errors. So they scar really well, there's no pigmentation. But as you go through the years, this lengthens. You know, for me, it's probably about 6 weeks. And then as you get older, it gets more. It can be even up to 90 days. Wow. Now, what happens when the skin has 90 days worth of changes, then the sun, pollution, all of these things can cause micro changes in the skin. And these then replicate. And that's what we end up seeing as telangiectasia, which is redness in the skin, pigmentation, and deeper lines and wrinkles. So you mentioned earlier the antioxidants. These are still great in your 50s to help mop up as much of that as possible. And then your retinoids ramping up. So we talked earlier about very gentle retinoids, now moving higher up to increase the skin turnover to try and overcome some of these changes. Now, treatments can do this as well. Okay. Things like HIFU, high intensity focused ultrasound, can help to stimulate collagen at the level of the dermis, so deep down. So that dermis is thinning. So doing something that will increase the collagen elements in it will increase the level of the dermis and give you more bounce to the skin.
Brilliant, thank you. And just as a final word, I think it's always good to, you know, kind of talk about your top tips. So yeah, if each of you could just give, you know, what are your ultimate skincare tips that you swear by?
I think every dermatologist is probably going to say sunscreen is vitally important, but not just from the skin aging point of view, but from a skin cancer point of view as well. Because as we get older, the other thing that does happen is our skin doesn't function as well as part of the immune system in the skin. So you are more likely to get benign as well as harmless growths potentially on the skin as time goes on. So it is important actually to wear the sunscreen from a medical point of view, but also an aesthetic point of view.
Thank you. And Ifeoma?
I think mine would be flexible in your skincare. So I think sometimes in your 20s, you get hold of products that you loved and they worked really well in your 20s. And then your 30s and 40s, you stick with these products. I think it's important to reassess and reevaluate your skin, probably every year and certainly through the seasons as well. And ask yourself, do these products still serve me? You know, if your skin has changed, have a look at the products. And if they don't, it might be time to have an overhaul.
Thank you. Well, ladies, that was so informative. So many notes that even I've taken down. So thank you so much. Yeah, that's it.
Thank you.
It's been lovely speaking to you.